Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about hysterosalpingography. Hysterosalpingography is the radiographic evaluation of uterus and fallopian tubes under fluoroscopic guidance. It is used to the fallopian tubes as partly or fully blocked. It shows the uterus shape and size. Indication: infertility, it is the main role. Recurrent spontaneous abortion, congenital anomalies of uterus, positive post-operative evaluation following tubal ligation, reverse tubal ligation, and next suspected case of genital tuberculosis. Contraindication: suspected pregnancy, acute pelvic infection, active vaginal bleeding, recent dilation and curettage, immediate pre and post menstrual phase, tubal or uterine surgery within last 6 weeks, contrast sensitivity. Patient preparation: done in first half of menstrual cycle in proliferative phase between 8th to 12th day. Patient to avoid unprotected sexual intercourse from the date of a period until investigation is over to avoid possible risk of pregnancy. If periods are irregular, do urine BHCG test to rule out pregnancy. Exclude active pelvic infection. Prophylactic antibiotics not routinely recommended. The patient should be fasting for 4 hours before the procedure. The patient should be advised not to be in intercourse between the booking the appointment and the time of examination. Equipments required: open-sided speculum, tenaculum, sponge stick, antiseptic, contrast medium, and acron, Cohen, cannula or balloon tip catheter. Contrast media. Doses: water soluble contrast media, urographene 60%, Conray 280, Trivideo 280. Volume should be in 10 to 20 ml. Procedure: informed consent is taken. Antispasmodic given before procedure. Patient is asked to empty bladder immediately before procedure. The patient is placed in lithotomy position at the edge of the X-ray table. A speculum is introduced into the vagina and the anterior lip of the cervix is held with tenaculum and gentle traction is applied. The cannula is inserted into cervical canal under direct vision. The speculum is then removed and the patient is carefully moved up the X-ray table in the supine position. Care must be taken to remove all the air bubbles from the syringe and cannula before injecting, as these may mimic polyps or fibroids. Under fluoroscopic control, 2 ml of the contrast media is injected to outline the uterine cavity. To prevent leak from the cervix, a downward traction should be kept on the tenaculum while keeping an upward pressure to the cannula. The injection is then continued slowly, governed by the patient's tolerance, until the oviducts have been outlined and free intraperitoneal spill of the dye is visualized. 3 ml contrast to fill uterine cavity and another 3 ml to fill tube. Up to 10 ml contrast is injected. Spot films are taken. After end of the procedure, antibiotic course is given and patient is informed about vaginal spotting for 1 to 2 days. This is how the procedure performs. This is how the filling of contrast media looks like. X-ray dye is injected through the cannula, through uterus, and then it passes through the fallopian tube. Filming. Subsequently, 4 images are taken at timed intervals to demonstrate the dye outlining the interior of the uterus, the filling of the fallopian tubes, and the potential spilling of the dye into the peritoneal cavity through the open of fimbrial end of each tube, fimbrial end of the fallopian tube. Scout film, tube begin to fill in, peritoneal spill has occurred. This is how the filming looks like. Aftercare. It must be ensured that patient is in no serious discomfort before she leaves. She must be cautioned that there may be mild bleeding per vagina for 1 to 2 days. For mild pain, analgesics may be given. Complications: pain because of dilatation of uterus, spillage into peritoneum. Infection, pelvic infection may be occur. Bleeding, vascular or lymphatic intravasation, vasovagal episode, pregnancy irradiation, allergic reaction due to contrast media, uterine perforation. These are the complications may ahead in the patient while doing the HST procedure. Advantages: avoiding possible cervical trauma and bleeding, ability of a single operator to control both the injection and exposure of spot films conversion fluoroscopic machine, avoid false passage, avoid potential uterine perforation, easy to obtain spot radiograph. Disadvantages: the catheter strip can block the tube, but this can be avoided by applying downward traction. The uterus adjacent to the bulb cannot be studied, but the balloon can be deflated for visualization. False positive or negative results can occur due to tubal spasm. Risk and benefit: minimally invasive procedure with rare complications. It can be provided valuable information regarding to infertility or problems carrying a fetus term. Minimal exposure to radiation should not be performed if patient is pregnant at this time of procedure. Use of it: used to evaluate patient with difficulty becoming pregnancy, used to evaluate uterine abnormalities, used to evaluate tubal patency. Thank you.